Hi, good evening. Welcome to tonight's table talk with our Shocker families. We are here tonight to talk specifically about your Shocker health, students' health, and this is really a important topic. I would say it's an immense topic of importance because as we prepare to dive into this topic tonight, it's really critical to acknowledge that college life, while filled with opportunities and growth of learning, also presents challenges and stressors that can significantly impact the well being of our students. And so, as you're preparing for this journey with your students, being able to understand and know what resources the university offers to support your shockers, and whether it's their physical health and well-being or the mental health, is really important. And so my name is Alicia Newell, and I have the privilege of serving as one of the assistant vice presidents for student affairs. And as a proud alum of Wichita State, I I am so honored to be able to share all of the resources that Wichita State gave to me as a student. And also wanting to make sure that our students have access to those the moment they step foot on campus. And so, working with colleagues across the university to make sure that we can partner together to bring those resources to you. And so, with me is my colleague, and I like to say I'm more her sidekick than anything. But Miss Kim Sandlin, who serves as the Director of Student Success, who also is my co-host tonight. So go ahead if you'd like to introduce yourself, Kim.
You bet. Good evening, everyone. As Alicia said, my name is Kim Sandlin. I serve you and your students as the Director of Student Success. We both equally lean on each other, I think, Alicia and I, in terms of support of each other. And then also the types of experiences that we are providing for you all as new families. Many of you are going to be new families. Who are on this call, or maybe all of you are. So we welcome you if this is your first Shocker Family Table Talk, or maybe you've been with us a couple of times already this summer. If you missed any of our previous episodes, if you will, they are recorded. You can find them online, and we can point you where those might be. And then, we're here really to kind of unpack health and mental health and those kinds of issues that face our students that you may know about or may not know about, but probably need to prepare yourself for, or at least think about as you are beginning to send your students to Shocker Nation and turn their care over to us and our awesome colleagues here. So I know we will get to Nurse Heather Stafford from Student Health. We all call her Nurse Heather, but I'm going to throw it over to Dr. Leonard. Your students hear from his area in a really interactive, fun session during orientation. They do a great job of explaining their services to students, and students they always rave about his area's presentation. So I'm going to throw it over to Dr. Leonard for his introduction and to get us started tonight.
Now I'm unmuted. Thank you, Kim and Alicia, for introducing me. I'm the director at Counseling and Psychological Services, and I will be talking about what we do and how we can support your student. And so I just want to say welcome. I'm glad you're taking time out to learn about our services. So let me present our slides. Okay, so let's talk. Oh, this got the so Counseling and Psychological Services. Oh man, I got the wrong slide up. But Counseling and Psychological Services, we changed our name last year from Prevention Services. I must have pulled the wrong one up. We provide services to the community as well as to our students, and really it's the Shocker community. And we offer a variety of things for our students. That is therapy, consultation, training, as well as outreach services. We'll go to student groups. We'll go to classrooms, and we'll talk about mental health concerns and kind of the current concerns students have. Our services are confidential. All services are foldable. No students are turned away. Our services are in person, as well as we have telehealth options. So if our student is not able to make it on campus, but is in the counseling, is looking for our services and is in the state of Kansas, we can counsel them. As long as they're within the state, we can work with them online. Now, most students do prefer in person, but they are always welcome to switch at any time to online. Say their car gets broken down or they're running late and have a private confidential space, they can transfer their session online with us. So our services also have therapists that will work to provide referrals to our student health services that you'll hear from Nurse Heather within the Student Wellness Center. And we collaborate and work together on making sure that our students get a full, robust mental health help here. All of our services are provided by licensed mental health providers and are supervised by licensed mental health providers if the therapist is in training. Students can always schedule their first appointment by calling 316-978-4792, or first-time clients can also schedule by visiting wichita.edu/CAPS. Again, our services that we provide are really to meet a variety of concerns that students have. The top 5 reasons students come in to therapy on our campus is depression, anxiety, relationship stress, academic stress, and then overall life stress. We also are trained in working with even more severe things such as trauma, eating disorders, any severe mental illness, bipolar disorders, things like that are things we also help with as well. So we talked about some of our individual therapy as being an option. We do couples therapy. We also do group therapy. Our group therapy as well as our crisis services are free as long as you're an enrolled student. It's a great way to connect and make supports on campus as well as figure out and learn and grow within ourselves and feel supported. Again, one of the easiest ways to join one of our groups is by talking with your counselor if you're currently working with someone, or just calling in and setting up a consultation. Some crisis information to know about our services is if you ever have a student or your student is in any severe situation, there's always 988. They can also text the crisis text line at 741-741, 24 hours a day. We're available 8 to 5, and if there's ever a crisis, you can give us a call and we will see you that day. One of the things that we really pride ourselves on here at CAPS is our wait time for students to get in for routine services is 5 business days. If a student just needs to see somebody, they can get in within 5 days on average. If a student is in crisis, we will get them in the same day. We make sure that that does not get pushed away, get sent away. Our goal is to help students when they need help. Some examples of safety emergencies or crises are when there's imminent threat to self or others, victims of recent assaults, hearing things, seeing things other people would say aren't there. All right. Some other services that are provided within CAPS and our friends at Hope is our Hope services, and they focus on preventing suicide, preventing sexual violence, preventing substance use, promoting mental wellness, both on campus and in the community. We have a Suspenders for Hope program with the WSU We Support You. This is a program that is created to really create a sense of community and not feeling alone when it comes to suicidality and mental health crisis. You'll see these shirts are something that when you get trained, you get one of these shirts for free, and you'll be trained in the Share As Support method. You can take our online training at suspendersforhope.com. There's also monthly in-person trainings on campus. And again, our training is free as well. This is something that great is for your student, as well as if you would be interested in taking it, you can also take it as well for free. Students also have the ability to get involved with prevention groups and become prevention ambassadors. ambassadors. YouTube, Twitter, Instagram, or that's X now, Facebook as well. And if a student ever would like us to come give a talk to their class, to one of their orgs, they can always request us at wichita.edu prevention requests. So that is a lot of our information. Our location is in the Student Wellness Center at the Steve Clark YMCA. We're housed with Student Health Services. So let me get out of there. I believe that is it. All right. So that's our services. It's a kind of a brief, quick little talk with that. But if there's ever any questions or any concerns for your student, you can always directly reach out to me and call the Student Wellness Center and ask for me, and I'll definitely talk with you. Thank you. I think I'll pass it back to Alicia.
Perfect. Thank you, Dr. Leonard. I know we had some questions, so if you don't mind hanging on till the end, we'll just address questions then. But I think one of the things that I would like to just kind of add on to what Dr. Leonard shared about our counseling and psychological services is that, when we talk about wellness as a whole for the university, our folks over in the Wellness Center truly go above and beyond in making sure that we can meet student needs. These two individuals that are joining us tonight, both Dr. Leonard and Nurse Heather, if we pick up the phone and say, hey, we have a student who is in need, they'll say, bring him on over. And so it's great to make sure that they understand what our students are going through, some of those issues and challenges. And if for any reason we're not able to provide that service or need for them on campus, they are the experts in helping us to connect with community resources. And I can't thank both of these individuals enough for all that they do to continue to serve our students just as they were their own, because they have truly helped our students get out of some situations where they just needed a little bit more support, and we're able to provide not only the guidance to that, but also the support once they were able to come back to campus so we can follow up. And so thank you to both of you for all that you do. If you'll hang on, Dr. Leonard, we'll take some questions after Nurse Heather goes on and presents for her department.
Thank you. Welcome, everybody. I'm happy to be speaking with all of you tonight. Let me pull up my presentation here. Maybe. Can you guys see it? I'm trying to get it up here, guys.
So while Heather is getting the presentation pulled up, I will share that our Wellness Center is located in the YMCA. And this is a phenomenal place because it's kind of like the one-stop shop for everything wellness, whether it's health related or mental health. And then if, we're looking at the physical aspect of staying healthy and fit and being able to go and work out at the YMCA, it truly has been a significant blessing for us to be able to have this new facility on campus to house this space. And so I'll let Nurse Heather talk to us a little bit more about all of the things student health that they have to provide.
Thank you. So like Dr. Leonard had mentioned, we are located in the Steve Clark WSU YMCA and Student Wellness Center. We're located on the first floor with counseling and psychological services on the second floor. Everybody kind of wants to know, what is student health services about? Well, we are generally a primary care medical clinic right here on campus that is very affordable and convenient for your students. We serve as pretty much a primary healthcare facility where we have lots of the services that your students need right here in the clinic. We have a lot of professional staff, physicians, mid-level providers with nurse practitioners and physician assistants. We have licensed nurses, but we also have applied learning opportunities for students to function in our clinic as laboratory assistants, clinical student assistants, CNAs, CMAs. Some of our students rotate through our billing department and through the reception area. So there's other opportunities for students besides just being seen here for medical care. We do injury and illness care, acute and chronic both, preventative health in the form of physical exams, immunizations, different things like that. We have specialty services like gynecological services, so we can do annual physical exams with pap smears, ordering contraception, things like that. On site, we do have our own laboratory where we do a lot of point of care rapid testing in-house, so for your strep, flu, COVID. But we also draw a lot of blood. We do cultures for wounds, urine cultures, all those different things. We have 4 different laboratories we send our specimens to that help us get very quick and affordable results for our students. Radiology services, we have a x-ray facility that comes out and provides x-rays and ultrasounds on our students that are very, very cheap and affordable. Vaccinations and tuberculosis testing, but then we also have our specialties that we either work with community specialists, or we also work with other departments on campus. So for instance, we have dietitians that come in. We have 2 a week that come in and see our students, but we also have the physical therapist from the WSU Physical Therapy Department that comes in and does non-surgical physical therapy for students, as well as students are able to see athletic training staff who bring their students over, and they all do a recreational type sports injuries for students who may need chronic care on joints, muscles, things like that. And then finally, we also have our medication management, and this can be in the form of all chronic illnesses like diabetes, allergies, asthma, as well as mental health. So we do see students for depression, anxiety, bipolar, OCD, schizophrenia, and we help manage their medication for them. We also do ADHD medication, and we do prefer that your students possibly have been through testing in the past in their high school or any other type of testing that pretty much confirmed the diagnosis for them. And if they did not have the formal testing, then we partner with our friends up in CAPS and have them evaluate any students that may need to just get that diagnosis and some support from their offices as well. Our ADHD medication management that does not have medication here in our clinic, in our pharmacy, but we can e-scribe that out for students. And so there are times when we do some telehealth services for that. Our LGBTQ plus healthcare, we have a lot of different options for those students. We do a lot of other different type of population specific healthcare. And then our patients accounts representatives and our business operations team, they work with students. Maybe they had a bill from an emergency room visit. They work with our students to help get them into our health equity fund for financial assistance for any sort of maybe higher end healthcare needs that they might have had. And second, because we're all here on campus, we can also refer to students to places like the Office of Student Accommodations and Testing, because maybe they need some help with their ADHD and get some test management and some resources and accommodations in their office as well. We really encourage parents to ask their students to get into our My Shocker Health patient portal. Your students can log in with their own information that they log in with their MyWSU portal as well. Inside the patient portal, they can make online appointments. They can communicate with our healthcare providers and nurses. Last year, we sent 30,000 some messages between us and students, and that is a really easy and accessible way for us to communicate maybe with students who maybe have a hard time with the language or other different types of needs that they have, that it's easy for them to communicate that way. They can pay bills. They can upload any health documents like immunization records, and we'll talk about that need for housing requirements here in a second. And then they can use any sort of credit cards that may not have their own name, but their parents' name to pay their bills that they may accumulate at student health. Our medication services run through our on-site pharmacy. It is considered an institutional drug room for our type of licensure here. So we can only take prescriptions that have been written by our providers. It's very easy for your student to transfer their care here if they want to. Usually after a couple of months, students would like to transfer their health care here so that they can easily get medications refilled, or if they have acute illnesses like sore throats, coughs, different things like that, then we are already in some sort of relationship with them as a patient. Our prescription medications, like I said, can be purchased in our institutional drug room if ordered by our providers. But if your student just wants to walk over and purchase over-the-counter medication, we have that available without an appointment. On our website, we have lots of our over-the-counter medications with prices. You can usually get a 30-count supply of Claritin for allergies, less than $3.50. So it's a pretty good deal. Lots of our medications are discounted. And then our mental health medications, we have 10 different types of mental health medications right here in our institutional drug room that we prescribe and dispense to students. But we can also e-scribe out medications and call out medications to any pharmacies of your student's choice, depending on their insurance coverage. Lots of different payment options here at Student Health. Students can use cash, credit card with their name on it, a health savings account card with their name on it, or a flexible savings account card. They can also have the fees put on their patient portal in the MyShocker Health portal. They can pay that way, or a lot of our students just choose to put it on their WSU student account, and then when they have their financial aid come through, those can pay for any services. A lot of times, most students will walk out of here with less than a $20 bill or a $25 bill. All insurance plans are filed. We are in network with a certain amount of insurance plans, but we attempt to file all insurance, especially so that it applies to all deductibles and preventative health benefits that your insurance might have. So here are a couple of requirements that you might want to keep in mind for your students before they arrive here in August. There's a tuberculosis screening requirement and a meningitis documentation requirement. Tuberculosis screening is for all new students. It is an electronic questionnaire. It's 4 questions. All students are prompted to complete this as right after they have registered for orientation. So your students have probably completed it, but you might check in with them just to make sure. Only requirement for vaccinations on the WSU campus is for students who live in housing, and it's not a vaccine requirement, but more like a documentation requirement. Either they have to submit documentation of a meningitis vaccination, or they have to submit the meningitis waiver that says they choose not to get that vaccine. However, being a nurse, I do need to recommend all of your adult vaccinations that students of this age group should commonly have at this time, including any COVID vaccines or any other updated vaccinations that they get right before they come to WSU. The meningitis documentation requirement only applies to on-campus housing students. Now, there are a couple of requirements. You might take a quick screenshot of this because this is a really good slide so that you know what documentation will be approved. We encourage all students who live in housing to get the meningitis type ACYW. On your students' vaccination list, this is usually your Menvio or your Menactrus. Students usually get their first dose of meningitis at age 11, and then they get a booster after age 16. The booster after age 16 is what we were looking for, and that is what will make your student compliant if they choose to get vaccinated. If they do not want to be vaccinated, it doesn't matter if it's a religious or medical exemption. Students just have to email me. I will send them the document waiver out to them by email. They will complete it, and like all of the other records, to complete this requirement, they need to be uploaded into our MyShocker Health portal. The instructions are there at wichita.edu/upload health docs. So now that your student's 18, they're attending college, we have to treat them like any other patient at a healthcare facility and maintain their confidentiality. This is a great time for your student to experience navigating the healthcare world on their own with the help of us as college health specialists who could kind of help guide them through that without, holding their hand through the whole thing, encourage them to make their own appointments. They can only access their own health records. They're 18, and the only way we would be able to give you health information is if they sign a release of information. That document can be found on our website. If your student has a chronic illness, I really encourage you to maybe talk to your student about, allowing them or allowing you to get information if you need to. I would say if your student has like a brittle diabetic diagnosis, maybe they need a lot more support with their ADHD, or maybe they need more support with their depression or anxiety. Have that conversation with your student, and the student needs to sign and date and give us exactly what information they want us to share with you. It may just be that chronic illness, but they may come over here for other reasons. Just know that we do have to maintain their confidentiality, and if we don't have that release on record, we cannot share information with you. If they're in some type of emergency situation and you're listed as their emergency contact, by all means, we're contacting that person. So don't be afraid that we would not share information with you if it was an emergency. If your student is going to be under the age of 18 when they arrive here to WSU in August, I really encourage you to go ahead and complete our minor consent for treatment. It is also found on our website at the link there on the slide. And this is a good thing to have on record so that if your student does come to us and needs to be treated for strep or COVID or whatever it may be, that we have that release on file so that we can treat them with medication and do laboratory services for them. So once again, we're located in the Student Wellness Center. We're available 8 to 5. That QR code that's located on the screen in front of you, that is a parent guide to bringing your new college student to WSU. Has helpful information, what kind of things to pack, what to remember to tell your student to know, what are their allergies, what are their medications. They can get into the My Shocker Health patient portal and put in their health history, put in their medications, put in their allergies, put in a pharmacy of choice, different things like that, how to make a first aid kit. And all of that can be found on that QR code. And that's all I have.
Perfect. All right.
Fast.
Woo, no, it's great. I love the last thing that you said is how to create a first aid kit. And I remember when COVID broke out and we had students who weren't able to go back home. And the number one thing that we would ask students was, do you have a fever? And they would say, I don't know. My mom's not here. And, as a mom, like, hey, are you warm? And so I think that's like a great tip is making sure as you're going out and you're purchasing those items for the resident hall move-in, a mattress topper, etc., is don't forget the thermometer, right? Don't forget a first aid kit, because those things are so essential and we don't know that we need them until we need them, right? Mm-hmm. And so I love that. But we do have a couple questions we'll jump to. And so the first one was, what do I need to do if my student needs to transfer psychological services, and when should they do that?
Well, if it's psychological services, the easiest thing they can do is call early August to schedule an appointment with us, and they can get scheduled for the first week of classes, or even before, whenever they show up on campus, we can start working with them. I think that's usually the best way we like to start, is sometime early August at the minimum. But your students always welcome to call whenever in the semester they would like to get going as well. If they're working with someone, they can also work with that current provider to get a release of information to transfer records to us. And then when they start, we can already have those records and read what has already occurred and pick up right where that past therapist left off at. And that's really all relating to therapy. Heather might have some thoughts about any medication services for psychological reasons.
Yeah, I always encourage parents in my presentations to, maybe make a doctor's appointment with your medication providers, beginning of August, end of July, maybe get 2 or 3 months worth of medications. So that's one less thing your student has to worry about when they first move into college, and then at that point, if they need to get refills and it's more convenient to come to us, then at least they've already have their medications. They can bring their bottles with them. And then, maybe it's a situation where they do need to transfer records. At least they have enough medications to give that other provider time to transfer the records as well.
Yeah, I think that's a great tip. Often we hear, especially in our parents Facebook group, one of our groups is, where do I send my kid to get prescriptions? And that's a great reminder. August, September, October, November, typically they're here for a couple months. And then it's either fall break, some return home for fall break, or even over Thanksgiving break. And that's a great time for them to get refills if needed. But making sure that they have that staple consistent until that time comes, or where they can transfer services over. Another question was, does CAPS diagnose and provide med management? And so I think Heather pretty much talked about the med management side that they do. And I think this is just one thing that I want to, again, share the praise of the work that our team does, is because seeing the increase of students that have a need, let's say for ADHD medication within our counseling and psychological services, and hey, there's a need, being able to partner with student health to have that need met on the student health side of things has been a phenomenal resource for our students. And so again, this is one of my favorite teams on campus, because they truly make magic happen for our students. And so Dr. Leonard, is there a limit of diagnoses that your office does not provide?
We pretty much,
what does that look like?
We pretty much provide every diagnosis within the mental health world. Some things we might be a little bit more hesitant based on how long we've been working with somebody. So we won't just diagnose everything because we saw someone for 45 minutes. We usually see them for at least a couple of sessions just to get a good and better understanding. And then sometimes we need more sessions. And we will work and collaborate with Heather's office to make sure that we're on the same page and we're providing the best care. And one of the nice things that happens because of us diagnosing is we can work with other departments on campus to assist with accommodations so that your students can even be more successful in the classroom. And so that's something that I will say that I'm really proud of as an office that we do is that we support our students to make sure that they can be academically successful. So if we see something and we diagnose something, we will help them with accommodations. So, or getting the information over to accommodations so the accommodations can do their work.
Perfect. I heard a rumor that student health has a chiropractor. Is that true?
The word is getting out. Yes, so we will have a chiropractor starting in August, and we'll see. That's going to be super new to us. So we'll see how a demand that was. It's kind of to help with those non-traditional, non-pharmacologic management of stress and pain and lots of those non-traditional things that people, may not. She's going to do dry needling, cupping, all of those different things that help with, muscle and joint management. So yeah, we're excited about it.
You said the magic word, cupping. Yes. So we already answered this question about student record access. And again, I think this is not only just for student health, but even our counseling and psychological services. I think we're all parents on here. And so, and Heather has a student who's actually a daughter who's a student. So she gets this more than anybody is, it's hard for us to tell parents, hey, we can't give you this information because your student's not given us that permission to do so. And so we empathize and we understand that it's frustrating and sometimes it can just be extremely aggravating. However, we really want to make sure that we're working to protect the student's privacy. And knowing that on the opposite side is that if we know that a parent is requesting information, often we're having that conversation with the student of, have you had this conversation with your parent, and coaching them on that. Like Nurse Heather said, if there is a specific need of, there's a chronic illness and they want to share information specifically about that, they're going to tell us that. But there may be other reasons why they're coming in and seeing someone at Student Health that they may not want, mom or dad or someone to know about. And we want to make sure we're protecting that privacy, right? And so making sure that you get the correct forms filled out, and that once we have those forms on file, they will oblige and share as much information as the student has given us permission to do so. So another question that came in was, what does my student need to take their insurance card with them for treatment, or can they have just a copy of it?
We can just take a copy of it. They can go ahead if they wanted to, even like today, upload a copy of that insurance card into the MyShocker Health portal. Because what's nice is that if that insurance plan is under the parent, then the parent can help the student put down their name and their birth date, so we know who the carrier of the insurance is. Once they've brought it in once, we can verify with insurance companies if they make appointments in the future, but then at least that card is already there. I always, though, encourage students and then tell parents in presentations is, always have a copy of it in a wallet or something as well, or on your phone, especially, so that if, let's say, you need to get some kind of medication that we may not have here and we e-scribe it out to a pharmacy, then you still have it to use in other community facilities as well.
And I'll add a little bit for us. So at CAPS, we don't bill insurance. And so with that, our services, again, if it's a crisis, if it's group therapy, that's free. And so if a student needs to be seen for one of those, we can see them for free. And then our other services are $10 a session. And if that's too much, we even reduce that because, again, we don't want any barriers to access or treatment for mental health therapy. And then the one other thing I'll add to the first part, Alicia, is yes, we protect confidentiality without releases. In the students over 18, we're not going to release that information to parents. However, if you're ever concerned about your student, you can always release information. You can talk to us. We just can't. It's not a two-way confidentiality where you can't tell us anything. But if you're concerned about your student, you can always call and we can listen, or you can even fill out a care report. So.
All right, we have another question that came in from one of our guests, Alba, and wants to know that if the student becomes sick, how soon can they get an appointment at Student Health Services? Ooh, that's a good one.
Yes, well, over 50% of our appointments can be made same day. But what I would say is, we prefer appointments. We want students to get into the portal and be able to make those appointments. But if they aren't able to find an appointment, they can just call us and we can have them come in through our walk-in portion of the clinic. So same day.
Perfect. Kim, did you have some other questions?
Yes, thank you. I've worked with a number of student leaders on our transition mentor team. And just based on some things that they have said, it's like, I think you may want to get tested for ADHD. Let's use ADHD because that's a big one right now. And our coaches are working with a lot of students on the academic side who have accommodations for ADHD and that kind of thing. But perhaps the students that we've been working with either didn't have access to testing or, it hasn't really bubbled up until now. And now they're, lots of things could lead to someone, saying that. So where would we point a student to? Where would a student go if, for instance, an advisor or, someone on campus is like, you know what, you may want to check out getting tested. Do they start with you all? Can they get that on campus? If so, is there a price? I know sometimes there has been a price and other times it's been free based on some grants and other things that the university has been, has received in the past. So can you talk a little bit about that if they haven't been diagnosed with those, a mental health issue and they think they may, because they'll self-diagnose, of course, because you can, do that on the web all night long and come up with 17 different things. But where would they go to start that kind of a process?
For us, if a student comes to the university and has never been tested before, has no prior medication services for ADHD in the past, the first place, and correct me if you have a different thought, Heather, is it starts with us over in CAPS.
Mm-hmm.
Now, if they have a history of it, and medication, they can start with Heather and they can bypass us. But if there's no history of it, the best place to start, I would argue, is CAPS. And the reason I say that is we will do an intake. And so if there's any differential diagnosis, if we're thinking it could be maybe anxiety and maybe not ADHD, we can explore that a little bit first before your student gets involved in psychological testing, a full battery that can be up to 6 months to a year wait, that can cost over $1,200 to over $2,000. They can start with us and we can do, in a sense, an ADHD screener that kind of moves forward with, okay, there's a lot of information here. We've done the intake, we've done some additional work, and then we can set up work or set up a referral over to student health to support them with meds, or we can work with our office that does accommodations on campus and work with them that way. So if your student, if there's any concerns that there could be ADHD, we are a great place to start if it's never been explored before. And then through that conversation, through those intakes, through those sessions, we can give better insight into this is an avenue that you might really want to go down more, or hey, we're seeing some more things that we'd like to maybe address first. And again, they're always welcome to a second opinion, but we do have situations where people come in and they think it's ADHD and it's not. And we have a lot of situations where it is. And we're glad that they did come in because then they get help. So.
Yeah, and I want to go back to the question about student health. How quick can you get into student health? We also know that getting a student into CAPS is much, much, much quicker on campus through CAPS than it is through the community, using a community resource. So, and that's something that you all pride yourselves on. You should be proud of that because a lot of students will sit waiting, needing the service, somewhere in Wichita perhaps, but our students get that that quicker support and intervention when they need it. So again, kudos to you guys. A couple of other things, I wrote down questions so I would not forget them, or points so I would not forget them. This is a great way, parents, if you have not had issued this challenge to your student, this is a great way to begin their experience with scheduling their own appointments. Because if they call student health or they call CAPS or they walk in or something anywhere on campus, particularly these two, because we're talking about them tonight, and they just show up and they're like, I don't even know. My mom told me to come in. I'm supposed to do something. No, they're not going to be made to feel stupid. Someone's going to walk them through the process. They'll be supported through that process. And if they mess up, it's going to be okay. And these are really good places to kind of learn how to do that and kind of navigate that with help, but also with the challenge of you got to do this when you're done here by yourself. So you better figure it out now while there is the extra support. So if your student is not used to doing this, highly encourage them to start scheduling their own appointments with student health and CAPS. Which is it is a separate process actually than, let's say, an academic advisor or a success team. If they want to see somebody on a success team or an academic advisor, they can do that from their Navigate app on their phone. They can't necessarily do that with student health and with CAPS. They have to go in, they have to talk to someone, they have to get something scheduled. So, or they might be able to do it from the website, but it's not from, the convenience of the palm of their hand. So this is some good skill building that you can work with your students on. 2 more things and then I'll stop. Sorry. The TB questionnaire, wanted to go back. Nurse Heather mentioned this. After your students signed up for orientation, part of the kind of confirmation was encouragement to complete their tuberculosis questionnaire. Some students do it immediately. That's fantastic. Other students kind of skip it and just move on. They do need to take care of that, particularly, really before classes begin. It is a 4-question yes, no kind of thing that they do through their MyWSU. And it literally takes less than 2 minutes, probably less than 1, if there's nothing to really report on that. So all they're doing is clicking radio buttons. Yes, no, yes, no, yes, no, submit. Boom, that gets the process rolling. Then if they answer a question in a way that might require some follow-up, then student health will follow up with them and take care of whatever kind of clarification they might need. So make sure that your student has done that. And then the last thing, also wanted to mention, the student health information is included in your student's pre-orientation module. So if you need to go back and review that information, you can get that, or the student can get it through their Blackboard and can refer to that presentation. So that's going to be available to them. And then we'll also make it available to them throughout the fall semester, as well as CAPS information throughout the fall semester in that new Shocker toolkit that is available to them in Blackboard. So we hear from our students, don't lecture me, tell me where I can find the information when I need it. So that is the purpose behind that toolkit in Blackboard when they're there working on classes, thinking about the exam, getting a little anxious, coughing, a little more than necessary, whatever, where am I, so we're trying to put that information where they're spending a lot of their time. And that's going to be in Blackboard. So I just wanted to make those points as well as where you can find some more information about these 2 services, or where your students can.
Can I add a couple things to that, please?
Sure.
So with the meningitis, your student has to always check their MyWSU email. They've been getting weekly emails from the housing department if they are non-compliant for the meningitis vaccination or waiver documentation. So if they're still getting those emails, they still need to submit something. If they submit something and they thought they were done with it, but they're still getting the emails, they need to get into the My Shocker Health portal and look for a message from us, because it'll tell them why it wasn't accepted as an approved document. So that's one thing. The other thing is students can get on their phones and make their student health appointments through the My Shocker Health patient portal. They can also maybe, sometimes our students who may be autistic or are somewhere on the spectrum have difficulty making those phone calls. And what's nice is they can message providers or the nurses and just ask questions that may be a little more comfortable with for them first before making a phone call like that. And that's a quick and easy way, because then they can answer those messages while they're in classes and not have to take a phone call. So just thought I'd throw that in there.
All great tips and advice. One thing that I will share, and I'll give folks a couple extra minutes to drop any additional questions that you may have out there in Shocker Nation for our experts with us tonight. But we have just a shameless plug, again, just kind of one shameless plug, is that we have a monthly parent family newsletter that we send out to folks. And one of the things that Nurse Heather is adamant about doing is giving us the update on what are kind of the ickies we're seeing on campus. Is it flu season? Are we seeing strep throat? Are we seeing certain things, so that we can help educate you to educate your students on what to look for, Is it, a student moving here from California and all of a sudden they're getting all kinds of allergies and things they've never experienced before? And so it's nice to be able to have some of, I want to create like a Nurse Heather Corner type thing in the newsletter, because the information that they give to us to share with folks is really important. And it's just a way, again, of reminding folks that Student Health is on standby. They're there and really can provide any of the services that your student may need with a primary care physician while they're here on campus. And I think as a parent myself, that gives me a lot of comfort in knowing that my students, I'm not going to have to find a provider out in the community. I can get that all done within my students' community on campus. And so I think that's just a great resource. So if you have not already done so, feel free to sign up, go to One Shocker Family or wichita.edu/family, sign up for our parent newsletter so you can get those wonderful tips from Nurse Heather and her crew at Student Health on what we're seeing on campus and ways to help support your students. Any other last tips of advice or anything you would like to share before we say good night? Whew. We have some good knowledge shared tonight. One of the things that I will say is that being with the university for roughly about 20 years is that consistently our goal as a campus community is really to create a supportive community where students can thrive, not only academically, socially, but mentally, physically, and emotionally. And our folks with us tonight, they do a phenomenal job of making sure that we're truly providing those wraparound services for the health and well-being of our students. And so if you ever have any questions, if your students are not sure where to go, have them call us, reach out to us, because the one thing that I have yet to find is that it's hard not to find help on campus. Everyone is willing to reach out and support and help our students, even if it's not our area. If someone goes to Dr. Leonard and says, hey, I don't know where to go because I need a refill on my medication, he's going to say, hey, let's go downstairs and get you an appointment scheduled with Student Health. And so don't hesitate to reach out to us, because we are all on standby, ready to support you and your shockers in their new journey. Any other tips or advice?
That's kind of what I was. Oh, sorry, Dr. Leonard, I saw you unmuted. Sorry. That's kind of what I was going to just comment on in terms of the level of personal care, that our staff and faculty show our students in terms of, I think it was in Heather's slides, it said coordinated care. And knowing that, Dr. Leonard knows the folks in accommodations and they know the success coach and we know the advisor, but we also know that Nurse Heather is there, and so we know that the students or the staff, particularly the staff, are very well connected to each other. We have a lot of people who have been here a long time, not just Alicia and me, but Nurse Heather's been here for a while. Dr. Leonard's been here for a while. And we do this work because we love it. And typically when you say, what do people like about Wichita State? It always comes down to the students and the people. And so we really do have a high quality coordination of that care and support. So you're absolutely right. It doesn't matter who you ask. Everyone will say, I can connect you to who you need. I'm a connector. I can connect you. Any campus PowerPoint that you will listen to will have, I can get you connected, and we can, and I think we do that pretty well. So you should be, your students should feel peace of mind, and you should feel peace of mind that if you ask one of us, likely we're going to know specific people and reach out to specific people to make those warm handoffs so that you know that you can trust the care and the service that you're getting from any of the services on campus, particularly here in the wellness area. So that's all for me.
Yeah, I think that's one of the coolest things about this campus that I always like to tell people that I work with in my field is I talk about how our center is not on an island. And so we're very much connected to all other campus departments. And so because of that, everybody is here to support. There's a really great campus of wellness going on. And so, I'm always honored that you guys just give us the opportunity to help your students and your children succeed. And so you're trusting us with them, and I don't want to let people down. And so that's what we try to do our best is to meet that. And I know everybody else in this room, this virtual room, is working on that as well. And then something on Kim's point I wanted to say too. I'm going on my 10th year here, and I'm probably the one that's been here the least in this of the four of us right now. So yeah, so I'm going on the 10 years here. And so, yeah, you have a lot of institutional knowledge and people that in these positions that know how to help your student. And something I wanted to say a little bit earlier, but this is the perfect time to say it now, is if your student just has questions. I talk with students all the time that are not clients. And so if your student just wants to know more about our services or is not ready to schedule an appointment, but just wants to talk with someone about like, what does this stuff look like? I sit down with students all the time. I sit down with parents and talk to them about what we do. And so, or I listen on the phone. So don't be shy. We're here to help. We're here to support your students. Encourage them not to be shy and reach out, because you talk to somebody and say, hey, I have a question. There's going to be 10 people answering that on this campus. And so, I think that's a really nice gem that we have here.
Perfect. Well, we have 1 minute left, so I know our guests are probably just anxiously awaiting for the announcement of who our winner is for tonight's drawing, and we have two. And so your gift tonight is this amazing Wichita State Parent Family tumbler. So this will be coming to your mailbox this week. Haley Loya and Alba Sandate. And so congratulations to tonight's winners, Haley and Alba. We'll be getting those to you in the mail. And also just want to put a friendly reminder out to not forget next week's session on July the 2nd, which we'll be talking about your Shocker student experience, what that looks like from Greek life to student organizations, community service, leadership, and more. Make sure you join us then. And until then, take care. And we'll see you next week. Have a great night, everyone. Bye-bye.